Oh, there we go, yeah. My name is Jeff, and I'm an anti-faxer. There's an F, see? We get that question all the time. So I'm going to talk about how you can actually take some steps to keep Indigenous patient data safe in the real world. There we go. Here's what we're going to kind of go through. We did a study starting in Civi, when did we start doing that? 2021. Across all the communities in Alberta, looking at privacy compliance, preparedness, awareness, all that kind of stuff, and ways that we could help them improve. So we'll talk about that study, what we learned from that, some of the recommendations that would apply to you, and we're going to look at specific privacy challenges within Indigenous healthcare, and then compliant communication, what that really means generally, but also how it applies in First Nations, and we'll look at some changes in the privacy landscape, some of which you've heard about already in the last sort of day and a half. The question we get after, is that an F or a V, is what is Brightsquid? So I'll explain that in advance. We were founded in the 2009 era by a radiologist who was having trouble getting x-rays to people for consultation. He wanted to get expert opinions, and we have to burn on a thumb drive or a DVD, remember that? And he'd mail it, and the DVD would be broken when it got there, and he'd have to do it again, or he'd have to move forward with care before he got the opinion back. So he wanted to share large amounts of data, or any data safely, with the whole care team. And so he sort of drew a cloud diagram in 2008 and put spokes on it and said, well, spider something is a good name because it's relevant, or octopus. And he learned about bioluminescent squid who are in the deep ocean, and they bring light where there is darkness. And he said, that's what I do. I spread information to help inform care. So Brightsquid means that. Today we have 65,000 healthcare organizations across North America using our secure email-like service. I'll talk about what email-like means, kind of. We also do privacy compliance consulting. So we do privacy compliance training, live and online, and consulting. Alberta specifically has a lot of requirements for privacy compliance that we help clinics and vendors and authorities navigate. You can learn more at brightsquid.com. It's pretty easy. We are really here to support full team-based care. So outside of doctors and nurses and pharmacists, chiropractors, dentists, physiotherapists, psychologists, everybody else who's involved in care, because we know that healthcare gets better when we all work together, and that's really kind of how we approach our jobs. I want to talk about privacy compliance versus security, right? So we all are here, probably have a lot of good information about security. We're maintaining the safety of that information while also allowing it to be accessible, right? Encryption's important, access controls. Security is a part of compliance. We have people all the time who say, my IT guy said this is fine. And it's secure, that's true, but it's not compliant. There's a difference. Compliance involves following the regulations, which involves a lot of process, procedure, all kinds of stuff. Things like when and where do you need consent, what consent, how do you get consent, who can you share information with, all that kind of stuff applies also that doesn't fit under the security category. A good example, sending email externally is okay if it's encrypted, if we're checking a security box. If we're checking a compliance box, it's not okay because webmail services, you're probably sending to a Gmail account, even if it doesn't look that way, are going to read that when it gets to the inbox. So that's not compliant. So there's nuance, sort of. So diving into the scan we did, we got response from 25 complete, 26 First Nation Health Center and nursing stations. We wanted to understand their level of privacy preparedness and compliance. We wanted to find out how we could best support a foundational level of privacy compliance, like being compliant, but also awareness and understanding. And the real goal was to support increase in patient trust because there was a problem with access. People were like, no, I don't really want to go to the clinic because they're going to tell everybody that I was there, or someone's going to find out about my health concerns. And so we wanted to help address that so people would actually access the healthcare they could. And our findings, before we even got any results, we were talking about this yesterday, It was really hard even to get people to fill out the survey for lots of reasons. One, it was hard to know who to talk to. There was no record of who was in charge of the clinic and who would have the information, so there was a lot of that. Capacity, this was vaccination days in COVID, so there was lineups out the door and people were just trying to get needles and arms. There was no time to talk about or fill out a 68-question online survey. So we know overwhelm is a problem, we know resource allocation, we know that we're all stretched in healthcare and probably across any kind of management in First Nations. Organizational continuity, so doctors, nurses, in and out, right? They're not there long term. We're not passing the baton of, hey, I did all the privacy stuff, now it's your turn. There's probably a gap, or there's nobody's even filling that spot afterwards. So there's no regulatory upkeep, and that's why things kind of fall off. Trust and cultural safety is a big issue, like I said. There tends to be a wide spectrum of roles and responsibilities and functions, and from an IT perspective, when you're looking at who gets what access to what information, who needs to be trained, who needs to understand their obligations when they're, even if they're just transportation, picking up a patient and dropping them off, what conversations are they having with those people? Talking about the last person I dropped off or something, right? We need to make sure that they know what they can do. Complex mental health concerns, how do we address that across virtual care, large geographic areas where it's hard for people to travel? And like I said, transportation, even just getting to physical care can be a challenge. So the good that we found in the survey was that people are generally aware that privacy compliance is a concern. One quote that has stuck with me is, I don't sleep at night worrying about privacy, right? They didn't know if they were operating compliantly, but they were pretty sure they weren't, and they were just waiting for the other shoe to drop when something bad happened, because they didn't know what to do. Most people, when they came on board, had to sign a confidentiality oath saying, I will respect privacy, physical security measures, so a lot of paper records locked up in filing cabinets, that's good. And TSAG, where are you guys? Somewhere, TSAG's here, right? Yeah, so firewalls, VPNs, all set up very well, thanks to TSAG for doing all that work. Some of the gaps, leadership, like I said, missing. In Alberta, we call them lead custodians, so typically a doctor or a nurse in this situation. In over a quarter of locations, there wasn't somebody in that role. So there wasn't somebody who was really in charge of the privacy compliance at the location. And so that was falling through the cracks because it'd been a couple months since someone was there, or there was a gap, and no one really said, you're in charge of privacy now, here's what that means. And probably even if they did, they're like, I'm busy doing healthcare. They also have the designated privacy officer, which is missing in almost 40% of locations. The privacy officer is responsible for the day-to-day running of privacy compliance, checking in to make sure we're doing things. When we work with clinics, we go, here's your daily, weekly, monthly, and annual checklists that you should be going through to make sure that you're on top of things and are staying compliant. They also manage privacy breach procedures, so if something bad happens and there's no privacy officer, who's in charge? Do we have a plan for that? So that's a big gap, and especially from an IT perspective, you can think if there's nobody in charge of privacy compliance, it's going to fall on your plate, and it's going to fall on your plate when it's necessary, right? So we're going to obviously be fighting fires pretty quickly all night. Privacy impact assessment in Alberta is a requirement under the Health Information Act, and a lot of times people will think about it as a point in time. Hey, I did that, we have it, it's in a binder somewhere, I don't know where, but we did it 10 years ago, and we're fine. But it's not reflective of what you're doing now. If it's even 5 years old, it's out of date and needs to be replaced. But what it does is it looks at your entire operation and say, here's some risks to information, and here's how we're gonna address those. So it should be unique and specific to how you operate today. And if you don't have it, or people don't know where it is, then it becomes a problem. And we found that there were either people didn't know where they were, or if they had them, they were 5, 6, 12 years old. Paper records is an issue. Sometimes people say, yeah, but they're super secure. No one can hack them, right? But also while we were doing this, if you remember, we had terrible fires across Alberta. And if those paper records burn down, now what, right? How do you provide care to those people who need care, but you don't know their medical history because it burned up? So you need to make sure you have backup, right? And business continuity. So paper records are not the greatest. Unsecure communications. So we asked people, do you use secure email? And they said yes. And we said, what service do you use? And they said something not secure. Like, we use this one. I'm like, that's not secure email. So a misconception. And how clinics are communicating with patients and with providers. Some things are, great standard stuff. I was just talking about fax, right? Fax is in the top 3 cause of privacy breach in healthcare all the time. I think the stats in Ontario, as of last year, between 2019 and 2022, there was 1,000 breaches in Ontario reported due to fax, right? Because we're sending it to the wrong place or something. Email is used pretty regularly. I'll talk about why that's bad. Text message, right? Because it's easy, and then we put all these processes in place. Well, you can send a text, but just use the patient's initials. The problem with putting procedure on things is that we create space for mistakes, and I'll talk about how prevalent that is, but we could probably guess. Social media is also a problem. I'll talk about why. So all of these ways that people are communicating create risk for you because you're probably going to have to be the privacy officer, and you're probably going to have to jump out of your chair really quick if something goes wrong. And if these things are going on, the chances of that happening are higher. Other gaps, documentation. So password requirements is actually kind of high. Like 62% of places having password requirements seems actually kind of high based on my experience across healthcare. So that's good. I would also thank TSAG for that. Mobile device and wireless policy. So can I use my personal phone on our Wi-Fi network that's also connected to our EMR where our patient records are managed? Can our patients use our Wi-Fi network? How can I use it? What sort of sites can I go to? What can I do on our Wi-Fi? Do we have a privacy breach response plan? 50% of places don't or didn't have one, which again, if a fire comes up, you want to know how you're going to fight it before it comes up. Data retention policy, the more data that you have, the bigger your risk, right? The more you have, the more chance of someone accessing it inappropriately. A security policy, almost 50%. Privacy training log, you want to know who knows their responsibility. If people are not trained, the responsibility falls on the organization or the lead custodian, the person in charge. But once you train someone, then you can say, no, you were told not to do that. And for reviews, you want to make sure that things are right? You want to know that our access controls are still appropriate, our software policy is still good because we're accounting for all of our software. We've updated all of our software. We're in the current version, so we have all the security patches. Mobile computing policy, what happens when someone takes their laptop off site? Can they let their kids do their homework on it? Can they sign into the Wi-Fi network without a VPN at Starbucks? Same with network firewall policy, like how do we maintain that? What are we doing on a regular basis to make sure that everything is still up to date? Hardware inventory was a big one because if you don't know where your laptops and your devices are, that's a big risk. It's a big hole in your privacy compliance. And if you can't account for stuff, then you almost kind of have a breach on your hands because you don't know where it is and what's happened to it or how long it's been missing. And agreements kind of ends up sounding a bit lame maybe, but it's about delegation of responsibility. Information managers is what they're called under the Health Information Act in Alberta. Ontario, I think they're called service providers. But your EMR, so whoever is managing patient information on your behalf, that's software people, so appointment reminders, scheduling, whatever, whoever's taking patient information and doing things with it. Shredding companies count under that, right? If you hand them a box of paper files, they are now in charge of that information, and you have to be sure that they're not just going to toss it in the woods, right? It needs to be properly disposed of, and you want to have an agreement from them saying that they will do that. Because if they do toss it in the woods and you don't have an agreement, it's your fault. So you want to make sure that they've said, yep, I will follow your rules for privacy compliance. And out of that, so you can probably guess some of the things that we came up with. Train people. We did build a training program. It's deployed. We have been working for 2 years, 3 years to try and get people to take it, and it's starting to catch. We've had hundreds of people take it now. Sorry, I didn't get those numbers yet. I'll get them after this. Fill in gaps. Make sure you have policies and procedures around privacy management, data management. Put controls for paper records if you're using them. How do we back those up? How do we know who accessed the paper records? How do we know if there's a paper record missing because somebody took it or we just lost it, right? Lost information is also bad for healthcare. And ensure a privacy impact assessment or something like it is done and up to date, right? So you implement a new software and you assess the risk to patients and you come up with a plan to mitigate those risks. If you can get off paper, I know it's hard, it's a lot of work, but it's a really good idea. Implement a backup. Make sure you have an offsite backup somewhere and test your backup. There was a dental clinic in Alberta that suffered a ransomware attack, and if you know about ransomware will hide in your network for a while and sniff around, and then it does something. So the ransomware found out where the backup was and went there and shut it off and locked up that too. Or in another place, their backup wasn't working. So for 6 months, their backup hadn't been working and they hadn't tested. And they called their IT company that they hired to set everything up and said, how come you weren't monitoring this? And they said, because you canceled your monitoring support and you're on your own, right? Like they couldn't recover because all that data was lost. They lost 90% of their patient data. And then implement secure and compliant communication services, email, other things, huge risk. The problem with dealing with a privacy breach is that it's a lot of work, and that distracts from providing care or doing other things that need to be done. Conduct software review and hardware audit at least annually. Make sure you know where things are, make sure everything's up to date so you have all the security patches and all the software you use, and hackers can't get in a backdoor that's been discovered. Understanding real privacy risk. So just kind of briefly, we pull stats. I've got all the Google alerts set up for all the news about privacy and what's happening in breaches and all that stuff. But Stanford University last year did a big study and says that human error is a factor in 88% of privacy breaches. So humans are our biggest risk, as probably everybody here already knows. Mistakes and misdelivery, things like CCC of a list of patients instead of BCC in email. Newfoundland last year did it twice in a span of 2 months in the news. One was a fertility clinic, so they sent an email to 250 patients who were patients at the fertility clinic and exposed everybody to everybody else. That's a privacy breach, even if it's just the email address, but now they're attached to that clinic as a patient there, and we're identifying the care that they're getting, and that's a problem. And they had a policy in place that you shouldn't do that, right? But 88% of breaches, human error is a factor. So the more we can get rid of process and reliance on someone to do the right steps, the better off we are. Misdealt facts. I'm not going to talk too much about facts. I already said it's a big problem. We kind of just accept the risk. Most, I would say probably 98% of clinics don't use facts compliantly. To be compliant with facts, you have to call the recipient every time and say, is this still your fax number? And they say, yep. And then you say, okay, are you ready to stand by your fax machine and get the sheets as they come out so nobody else sees it? And they'll say, no. Okay, when's a good time? How's 3:30 for you? It doesn't work for me, I gotta do something else. Then it becomes complex, right? Fax is not compliant. Even if it's e-fax, it gets tough because what happens if the fax server goes down? We've worked with a number of clinics who their fax server just locked up. And the provider says, oh, we'll have to reset it. Well, what do we do with all the files that are on there? We delete them, right? And we don't know who sent a fax, but all those people that sent a fax to that fax server got an okay message saying the fax was received, so they're not going to follow up until a month or two later. And we work with one pediatric cardiology clinic, and a kid came in with blue lips because their fax referral got deleted when the fax server got restarted, and they had to wait an extra month or two for care because nobody knew that they were expecting it. Ransomware 85%, we'll say, over 80% of ransomware attacks come in through email. 4 of the top 10 attacks in 2023 hit healthcare. That's in the US, so we're talking like top in terms of volume of patient records. Hundred millions of records, actually, in those. And now ransomware attacks, they used to just encrypt your files so you couldn't get them, but people would just launch their backup and say, forget you, ransomware. But now what they're doing is they're locking up your files and they're stealing them and releasing them on the dark web and selling it. And they'll say, I'm going to sell them to everybody else unless you pay me. And even if you pay them, they're still going to go collect the money over there anyway, right? People ask us, well, if you pay them, will they still release it? I mean, they're criminals. So what the result of all this is a privacy breach I kind of mentioned. It distracts you and the healthcare teams from providing care, from regular operations. And there's studies that show that access goes down and quality of care goes down following a privacy breach because we're doing other things. And a lot of times there's a knee-jerk reaction after a privacy breach versus planning in advance, and we implement all of these controls that may or may not be necessary or right or maybe too complex, and it slows everything down, and everybody's trying to adjust and learn how to do things differently now, and we forget stuff and drop balls, and we get distracted. In Alberta, so between 2022 and 2023, the Privacy Commissioner released about 100 breach notification decisions. So someone reported a privacy breach, they investigated, and here's what they found. These are sort of the types, this is the categories. Out of 100, you can see about 46 of them are a cyber attack or ransomware. I mean, I separated out ransomware because it is a cyber attack, but it's a specific one, and you can see how prevalent it is in terms of cyber attacks. Mistakes, just general ones, but some of them are email. Does this work? Yeah. Like 4 of those mistakes were somebody forgetting to BCC an email. So people say, oh, we have a process about that. But 20% of the time, people forget, right? Well, I mean, not 20% of the time, but 20% of breaches that were mistakes were somebody forgetting to BCC a list of patients instead of CCC or a list of recipients. Compromised credentials, right? So password protection, password policies is really good, changing passwords. There's like a mix between, some people say, or some studies have shown that requiring people to change passwords every 3 months forces them to create weaker passwords. They end up making weaker passwords because they want to remember them, but it's probably no excuse. Phishing is showing up, so people are actually sending a message. Sometimes it's spear phishing, sometimes it's really targeted, but a lot of times it's just broad. Hey, click this link and fill out this form, and it's a fake form, right? We've all seen that. Or fake multi-factor authentication sites, all this kind of stuff. So people need to be trained to recognize that kind of stuff. So with all those mistakes, why do they happen, right? We can guess. People are overwhelmed, overworked, they're stressed, they're tired, they forget, they're in a hurry. And so this once, it doesn't matter, right? Like, we could probably all put up our hand if I said, who has just emailed their credit card number just once because I just had to do this thing, right? Like, people do this because, like, I don't have time to deal with this right now. So anything that you can do to reduce the overwhelm, to reduce the workload, to simplify process is going to support privacy breach prevention. It's probably the easiest, maybe, but it's one of the best things you could do for an organization to help support privacy compliance, right? So make sure there's a plan and policies in place and people are aware of them so they have procedure to follow. Like that person that said, I can't sleep at night worrying about privacy, she didn't actually know. She didn't know what to do. She was just worried, and that was more stressful. So helping people be trained, knowledge eliminates stress. They're okay, I know what to do. I understand. If you train them about what privacy practices or policies or principles are, they can sort of apply that to what they're doing and make better choices. Eliminate excess manual effort. Healthcare clinics are the worst for implementing extra manual effort. Printing a digital document, going over to your printer, which is probably also your fax machine, feeding those through the fax machine, and then taking those papers over to the shredder and shredding them, We just spent, I don't know, if it's a minute doing that, how many times do we have to do that in a week? We're wasting resources or wasting time, and we know this in our heads, and we're a bit frustrated even if we're not really aware, right? Stuffing envelopes in the mail, all this kind of stuff creates extra work. We, in our system, what do we have? Like manual form entry. Use digital forms, right? Don't have, like, if someone has to type out someone else's handwriting on a patient intake form, that takes minutes. We've done those tests. Our secure email service has templates that people can just say, select the template. It automatically puts the patient name at the top, sends them the intake information, the instructions, the forms they need. And that saves clinics, on average, overall, about 4 to 6 8-hour days of typing every year. So if you think about sitting there for 4 to 6 days and just typing for 8 hours, sounds super fun. You can take that off people's plate, and they can do other things like pay attention to patients. Complex IT configurations, the more we can make things simple, don't make people jump through hoops to do stuff, make it straight up. Vulnerabilities, I mean, I've all been through this, but how do you address these things? So training, software audits, make sure everything's up to date so people aren't going to be able to hack in. Make sure you have agreements in place. Make sure you've investigated your software or other partners to understand that they are doing things properly and are going to protect your information. Our secure email service, this is a small bit of what it does, but we scan every attachment someone tries to upload. We don't allow executable files and a bunch of other stuff so that we're keeping viruses off. It is a closed system, so there's no spam, there's no phishing. Everybody on our system is identity verified. And we're not sending information across the open internet where it could be intercepted, or it's not showing up in an inbox where it's going to be read by Google so that they can mark it. They say, oh, you're receiving dermatology care, you might be interested in this skincare line, right? That's a privacy problem when they're targeted based on their healthcare treatment. And we have a number of other automatic breach prevention measures, like you cannot CC a list of patients. If you type in a list of patient emails, you can send up to 20, you can put up to 20 recipients in each message, and if they're all patients, they will only see themselves. They won't ever see other patients. That's a technical safeguard. Safe and appropriate communication. So we work with the Alberta Indigenous Virtual Care Clinic. Michelle is the manager there. She is very smart and diligent and does a lot to make sure that they're doing their best to serve patient needs. She did a webinar for us back in June. It's recorded on our website, on brightsquid.com. You go to resources, you'll find on our blog Michelle's presentation. It's really interesting. It's good just to kind of see how they've done things and who they serve. So what we learned is that, and this is probably not real news to you, people move around. There's not a fixed address all the time. They might share phone numbers. They might have a different phone number this week or next month. Cell coverage is weak in rural areas across Canada. So we want to look at low bandwidth solutions. Not everybody lives in a connected home. So we might have to have other ways for them to connect. And kind of with all this, the default might be looking at email or social media or text message because that's what the patient has. But it gets to be a problem. What we've also learned working with the virtual care clinic is that you can support patient access with some consideration, right? Provide choice and flexibility, right? We don't have to be rigid. No, we have a phone number. That's how you contact us. We don't answer our phone during lunch, so you better make sure you call during our phone hours. That gets rigid, and people will just avoid accessing care. Like they're like, that's too hard, right? So they provide a lot of options. People can phone. They can do in-person stuff. Secure messaging. They use our secure messaging service. They do virtual visits. They have website intakes. You can just go to their website and request an appointment or to be paneled as a patient there, and anybody can access care through them. They allow extra time for appointments, right? So instead of a 12-minute appointment that most medical clinics have, they have 30 minutes as their standard. They just allow for that time. And they always accept more than one concern because they know that patients will call and say, I have an infected toe or something, and then they show up and they end up having a couple of the things that they want to talk about. So they make sure that they have time and space to address that. So then the question comes down to, like, how can you support additional capacity to do those kinds of things so that we're serving patients in a sensitive way. They use secure messaging for a number of different things. So remote screening and assessment, so we have online secure forms, like I said, so they do screening for patients through forms. They also do surveys, so satisfaction surveys, how can we do better? We have systems for diabetes screening, vaccines. We have an HPV vaccination screening program. And they also do chronic condition self-management. So you can set up a template that has information that people with specific conditions might find helpful, or forms that you want them to fill out on a regular basis, or whatnot, little check-in information that helps support that. So it reduces the burden on the clinic. We talk about creating capacity, help patients help themselves. Asynchronous appointment requests at 9:30 at night. I'm not feeling well. I want to go see the doctor tomorrow or talk to someone tomorrow. I can send a message at 9:30 at night. I don't have to worry about waiting till 8 a.m. and hope they answer my phone call. And patients can send a picture or something else, right? They can say, oh, here's the rash, or here's the cut that looks infected. What do I do about this, or whatever. Oops, that's the wrong way. Secure appointment reminders, our service integrates with MedAccess and PS Suite from TELUS Health. If you have any of those, you can use our automated appointment reminders, which are fully customizable by appointment type and provider. So you can include instructions because it's private. We actually create a secure landing page for each appointment. So patients get a link, they click on it, they log in to identity verify, and they can see instructions relevant to their upcoming appointments. Here's how to get here, here's when to show up, here's some information about a procedure you might be having. And it improves access to care by reducing no-shows and making sure that patients are prepared when they show up. It also is collaborative, so we have a shared team inbox, so everybody has their own login, but they're serving as the clinic. They're sending messages on behalf of the clinic, so it's not that Wendy has one inbox and messages end up there, but she's not in until next Thursday, so the messages are just sitting there unaddressed. Everybody can see the messages that come in, and it's usable with anybody across the circle of care. We get a question about, like, what about my EMR secure messaging platform? Well, your EMR secure messaging platform is probably just made as a patient portal, which contributes to patient portal fatigue, we call it, meaning that patient has a new service to use with every different provider in their circle of care, and shoot, which one is it that I use now, and what's my login, and where do I go, how do I get that information, versus our system that patients can use it with all their providers, and you can use it with the entire circle of care too. So I said I'd talk a bit about email. I kind of covered a lot of this stuff. It's how ransomware gets in, so that's a risk you need to decide if you want. It travels an untraceable path across the internet around the world. So path of least resistance for email, right? It'll go to any server somewhere, not really caring where, but that means that as it travels to other soil, it falls under different privacy jurisdictions and different privacy rules, and you don't know which one. So technically, when it hits that, it could be used in some way. Also, we know that hackers watch the internet traffic for healthcare data so that they can steal identity. Healthcare data is great for identity theft because it has everything you need to assume someone else's identity, and that's a huge risk. In the US, people sell that information so that people can access care, right? They'll impersonate me and go get healthcare, and then conveniently the bill comes to me. And I'm like, no, I still have my appendix. We also know that webmail services, like I said, read the information, right? If you're dealing with a patient, it's going to Gmail or Hotmail or Yahoo or something, probably, and they don't own the information. Gmail or Hotmail or Yahoo do. Text messaging, phone network can be hacked. I used to work in a SIP trunking startup that does like kind of back-end telecom stuff. The guys I met were like old spies for the CIA from the 50s and 60s who were like tapping phone lines and all this stuff. It's really easy to hack the phone system. And text messages are stored on servers that are not stored as health information. They're not ever treated as health information because that's not the expectation. Also, people might share phones, as we know, and there's no way if you send that to the wrong number, it's tough to know, I'm just texting this number, is this the right one? I don't know. I just put a number on my phone. We don't know if it's the right person, and there's no way for us to say, oops, can we pull that back? So acceptable use, what the virtual care clinic does is they might, if they have to use text, they'll just say, please call us if they need to get a hold of a patient. Social media, Again, the platforms, Facebook owns your Facebook messages. You don't. People seem to think that they own their Facebook content, but that's not true. It's a free service. That's how they pay for it. And they advertise, same as the email guys. No automatic logout. So if they're using Facebook at a library to get internet access and they leave and they don't forget to log out, someone else can sit down and read all that stuff, impersonate them, whatever they need to do. And then where is the information stored with rules? Again, send a message, please contact the clinic. So when you're looking at secure communications, what safeguards do you want? Ensure compliance, obviously. Closed systems are better than things that use the open internet, even if it's encrypted, like I said at the beginning. You want to make sure that the service will agree that they're not going to use the data for research or marketing or sell it or do whatever else with it. They will only do the delivery and that's it. And then encrypted in transit at rest, obviously. You want ransomware blocking, always on encryption, so like encrypted Microsoft Outlook. A lot of times it's toggleable, right? Sometimes users are able to say, I don't want encryption on this message. And then if the next message needs it and they forget to turn it back on, what's the point? The BCC versus CC thing I talk about a lot. Multi-point identity verification. So on our system, if you send a message to a patient that you're connected to, you'll see their name, their date of birth, their email address, and their province. So you can be pretty sure that it's the right Jeff McKay. My email address is jjeffmckay at something. And there is a Jeff McKay. There is a Jeff, like my first name is James, it's not Jeff. And people always, is there really another J? I'm like, and I don't know how many people have just left off the J because they thought I'm a fool and don't know my own email address, and send it to Jeff McKay. I almost didn't get a job at the Banff Springs Hotel one time because there was another Jeff interviewing at the same time, and they confused the interview times, and they called me like, Jeff, let us know when you're available to do your interview. It's like, we didn't have anything scheduled. Yeah, you did. It wasn't until I started work and I met the other Jeff. It's like, oh, you're the guy. So that's a problem, right? We need to be able to identify people. We want to have protocol for reliable recall. Even in email, if you send something, sometimes you can try to recall it, but once it leaves your server, it's in the hands of another company, and they're going to ask the recipient, say, hey, Jeff wants to recall that email he sent you. Are you good with that? And they'll be like, no, I'm keeping it. I don't know. You don't have any control. So you want to make sure you have control of the information. And you want to ensure that there's passwords and no sharing. So people can have individual accounts. So that if someone leaves the organization, you want to be able to deactivate their account without messing up everybody else's workflow. Like, hey, this week the password for the email account is this one, right? You don't have to go through that process. Everybody should have their own login. So what that means is hire services that use a unique identifier. Some services will supply a new email address to users, which gets complex, right? Again, for patients, it's an access issue. Oh, shoot. I know they gave me an email. Like for me to log into my Microsoft account all the time, I have no idea what my Microsoft email address is. Have a familiar interface, something that's easy to use. We have patients on our system that are over 100 years old or have had, and they call and say, I can't remember my password. And we say, oh, you just click the little forgot password link and they go through this. And they're like, awesome, great, thank you. Do you need any other help using the service? Nope, it's pretty easy. Low bandwidth demands, so because it's email, it's small packet stuff. It's not voice streams. It's a one little thing that gets delivered. It can get through narrow bandwidth pretty easily. I've heard from patients that said, I was out camping, got stung by a bee, had an allergic reaction, needed to get to a pharmacy to get some medication, and I couldn't get a phone call out, but I was able to send a secure email message to my clinic, and they were able to get the prescription back, and I could get the care I needed. Safely access over any connection, so you don't want like on-prem stuff. SaaS-based stuff is good as long as it's secure. Streamlined administrative process. How do we make jobs easier for people? How do we take away work from them and not make it arduous? There's a system used by one profession in Canada that's nationally available to all their members for free, and you get what you pay for. And it's really arduous to even just address a message. You got to go to a couple different screens and pick people, and if they're not in that profession, it's a little more difficult. And you don't want to have to be working on it all the time, right? SaaS stuff gets updated on its own, web-based things that you don't have to reinstall and make sure everybody's got it deployed. Support individual user accounts. Again, no shared passwords. If you're sharing passwords, you cannot track access. So if something happens and there's a breach, and the patient's like, how come my information is all over the internet? You need to be able to see who had access to that information so you can start to track where the leak was. And if everybody's using the same login, everybody's at fault, right? Like we can't properly control that. And true two-way communication. So imagine trying to say you're patient-centric, but patients can't respond to your messages. Like, we're trying to have conversations with people and engage patients, but they can't engage if they can't respond to what you're saying and input on their care. And provide patient user support. Patients can call our support team and ask questions, right? The 100-year-old great-great-grandma who doesn't remember her password can call us, not you, right? If they have to call you, you got to put down your job and do support on our service. That seems silly, right? So ask those questions. Hey, what happens when our users or our connections need support on the system that we're using with them? Do they call you or do they call us? Usually the answer is they call you, but they can call us. A couple slides left. How am I doing? Are we good? Are we good for time? Yes. I drank a lot of coffee just to be sure I could get through all this. Artificial intelligence, I know it's a topic. I know it's a topic here, and it does have impact. We talked about scheduling, right? AI for scheduling, that's a cool idea, I like it. Even just, like grouping conditions or issues together so that the clinicians can kind of keep a mindset, right? If you're jumping around to different things all the time, it's harder, but it's good to be kind of in a flow. Diagnostic assistance, treatment planning, all this stuff is happening. Transcription, obviously, right? From a privacy perspective, the privacy legislation in Canada, for the most part, certainly in Alberta, is dusty and rusty, right? It was written at a time when AI was not a consideration outside of the Terminator movies. And so it doesn't account for that, and in fact, it kind of stands in the way. So the Canadian AI legislation, I don't know if that was talked about yesterday, there are requirements that you would have to disclose any use of AI and provide an opt-out. So if a patient says, well, you would have to tell them, hey, you're a patient here, we're going to start using AI for this. And they say, well, what does that mean? How does that work? And you have to tell them everything. And then they can be like, no, don't put my data in there, right? So that's stuff that we have to be aware of. You have to be able to provide that option. But also, like from a privacy perspective, one, what information was that AI trained on, right? So you have to be sure that you can defend it in care. So if you provide treatment and it doesn't work out, but you followed the AI's advice, was the training appropriate? Or are they using the information to train the AI, right? That there's consent-based stuff on there that you need to make sure is covered off. You can't just throw all your patient data into a language model or whatever and have it spit out some stuff. There's process involved, and the regulations are changing and getting updated to catch up so that this stuff is available because it's good tools. Make sure, get an agreement signed. In this case, it's great. Like, make sure that, hey, you're not going to use the data for this and this and this. How anonymized will it be if it's used for certain things? All that kind of stuff. And when you talk about anonymization of data, like, usually by the time a data is anonymized enough, it's so innocuous that it doesn't really help. Federal changes, I talked a little about that. Privacy program requirements, so you're going to have to probably say, here's all the things we do to protect your privacy. So that privacy impact assessment becomes important because if you haven't done that work, you can't show it to people. AI rules, like I said, right to object or restrict processing. Yep, fine, use my information with AI or don't, or use it in these ways and not these. I think you heard about the Connected Care for Canadians Act yesterday. So that's looking at starting to mandate data interoperability across the spectrum of care and address data-related harms outside of privacy breaches, right? Because there is harm to inaccessibility, right? If information's not accessible and clinicians have to make a decision, they might make the wrong one. So we want to make sure that all the information is where it needs to be and kept private. Organizations that are falling victim to ransomware attack are getting fined by the government. Not in Canada yet, but privacy commissioners are starting to get more authority. So if in the US, a number of organizations that have reported a ransomware attack, and organizations that don't report ransomware attack, this is my favorite trick. Because breach reporting is mandatory under HIPAA in the US and in Canada under HIPAA federally and the Health Information Act in Alberta at least, but probably definitely in Ontario and BC as well. Organizations that got hit by ransomware and didn't report it, the ransomware gangs that infected them reported it for them. Like, no, we're going to make sure everybody knows that we did our job and you didn't do yours. We used to say, or we do say in our privacy training, we have to be right all the time as people who are protecting patient information, and hackers only have to be right once. So diligence, right? That process of making sure that we're still doing things right, we've updated our policies to be correct to the way we operate now. So people get fined because they didn't take steps to prevent ransomware, right? It's kind of easy stuff. And if you did nothing, then you're in big trouble. If you did something and it still got through, it's like, okay, well, you did the right things. You took reasonable measures against reasonably anticipated threats, but you have to know what those are. What are the threats and what are the measures that protect against them? And, I mean, we know this anyway, but employee information is important too. During COVID, we started taking people's temperatures when they came into work and writing them down, right? We were tracking different things. We were tracking people's conditions. The AC tech was coming in to fix the AC, and we had to take his temperature. So employee data is important too. We need to make sure that we're handling that respectfully. Provincially, so in Alberta, we had a new privacy commissioner a couple years ago. When that happens, perspectives show up, right? So interpretation changes and how the rules are applied, right? The commissioner now is more literal with how the rules are interpreted basis from before, in strategic ways, I'll say. And in Alberta, we have the MAPS program, so it's not a good acronym because it stands for Modernizing Alberta's Primary Care Health System, MAPCHS, I think. So there is an Indigenous Primary Care Healthcare Advisory Panel, and they have recommendations on providing culturally safe and appropriate care, ways to address inequities in access, integration, and quality, and making sure that Indigenous peoples are treated as partners, right? Not just receivers of care. How do we work together to give people the care that's appropriate, necessary, and desired, right? Like, how are we providing care in a way that patients want? The group that I'm on the board of, the Health Coalition of Alberta, relational care is one of our goals, which is kind of a step above patient-centered care. Relational care is a relationship where we're working together to achieve our goals. BC has something specific called the Anti-Racism Data Act. That was passed unanimously in the legislature in 2022, I think, which looks at tracks data around access to care, provision of care, to make sure that there's equitable access and we're not excluding people based on who they are, and tracking that. Every province in Canada is looking at the implementation and the effect of that legislation, because if it's successful in BC, then why isn't everywhere else doing it too? Because if you're not, you're kind of allowing harm to continue. Ontario Private Commissioner can now impose fines as of last year. They're, I think, one of the first. So if somebody does something wrong in privacy, you suffer a privacy breach, they can fine you, not just say you shouldn't have done that. And from the federal perspective, and probably more provincially, we'll see more PIA requirements. The Health Information Act in Alberta is the most strict privacy legislation in Canada. It supersedes the federal privacy acts for now. But with privacy becoming such an awareness issue, when I started doing privacy stuff, we launched our privacy compliance consulting in like 2017. The perspective from most clinics was that but patients don't care. They don't care. If I email them, they don't care. That is not true, right? It might have been a little bit more true then. The federal research on it says that 95% of patients do care. I think the Commerce Board of Canada did research that said over 40% of patients will travel 40 kilometers or more for a provider that they believe is going to be more accountable about protecting their privacy. So we want to make sure that people can trust us and put that up front. When we do privacy training, everybody who does the privacy training gets a certificate, so a lot of places will just post those on the wall and say, hey, look, we're taking steps. Every healthcare location in Alberta is required to post like sort of a privacy declaration with the information for the privacy officer if you have any questions. These are all those things you can do to make sure that your privacy work is visible. If you're going to put in the effort, you want people to know about it, right? Because we're trying to address trust and access and help people get the care they need. So be loud about it when you're doing things right. Are there any questions? Nice. I did it. I answered everything. So if you, yeah, you can check more out on brightsquid.com. We have like privacy webinars. We have privacy podcasts that analyze privacy breaches, what happened, how you can prevent it from happening in you. Lots of stuff on there. And if you have any other questions directly you think about afterwards, jeff.mckay@brightsquid.com. Not J. Jeff McKay. That's my Gmail account, but this one's just Jeff.